Hi everyone, I'm Dr. Lisa Jewell.
I'm Vicki. I had a wonderful surgeon who recommended Dr. Jewell as the best plastic surgeon in the South Bay.
Tell me more.
So I met with her, and fast forward a year of surgeries and reconstruction, and I tell people I'm Wonder Woman. I have new knees, new hips, and new boobs. And thanks to Dr. Jewell, people will look and they can't tell. Free in December of 2018, so 6 years now.
One of the things that I love about Vicki though is that she will say, I was in my support group and people were asking me about my reconstruction, so I just showed them. I just flash everybody. I don't mind. They look so great. I just want to make sure that everybody can see how great they look. And I just think that's so wonderful that you're so open and want to share your positive experience. Earlier this year came in and I had shared with you about my experience with the weight loss medication semaglutide. Tell me a little bit about why you decided to kind of take the leap of faith and start the program.
Exactly. Well, I should say when we had that meeting, Dr. Jewell usually will take photos. And I think I might have started crying, or at least I certainly looked upset because I said no photos. I said I was feeling just out of my own skin. My husband passed away 2.5 years ago now, and I slowly, after maintaining my weight for many years, had started putting on weight to the tune of about 1 pound a month. So I was up about 25 pounds, which on my small frame is a lot of weight to carry. And so that's when Dr. Jewell told me about the GLP, and we started talking about it, and I said, this sounds like exactly what I need. Because I'd gone back to my routines that had worked in the past, and they just weren't working for me.
The death of your husband, I think everybody goes through a mourning period. There's the loss of your partner, and as you shared with me, you're used to cooking big meals for the two of you.
Right.
And so that's also a real adjustment for you. And also a reminder once you're making those smaller meals that he's gone too. Loss is one of those things that actually does also reduce your risk of cancer. And so, adopting a healthy lifestyle and really losing weight is going to extend all of our lives, which is why all doctors are going to advocate for patients to lose weight if we can. But the key is to do it without making yourself more miserable.
Exactly.
And one of the things that I really liked about my experience with the medications is that, it really takes kind of all the thought out of it. And I probably shared with you that I would wake up in the morning and the first thing I would do is think about what I was going to have for breakfast, lunch, and dinner. And I think we shared that experience too. And so when you started the program, tell us a little bit about, did it start right away? Did we have to increase your dose? What was the process beginning the program like for you?
Right. Was gone. Because like you, I would food always has a track in your mind. And it's like, what am I going to eat next? Where am I going to go? What am I going to do? And that was just gone. And so what it did was give me time to think about and make the good decisions I wanted to make. I lost about 1 pound a week, which when you start reading about GLP seems like so little. People would lose a lot, and you kept saying, no, that's a healthy weight to lose. And I did come to that conclusion finally that was a good steady. And I pretty much through the whole program, if I look, I was pretty consistent at losing 1 pound a week. And we did raise the dose. We started with the lowest dose. I think we kept that for 2 months and then went up a little bit and then up a little bit more. I think the biggest side effect I had was constipation, but having done a lot of surgeries over the years, I know how to deal with that. So I immediately started doing collays. I added some prunes in the morning, and that worked. Nausea, which we weren't sure, it didn't have to do with the increase in the dosage or changing anything, It was just kind of randomly happened, and through a GLP networking group I'm in, that was a really common answer. It's like, oh yeah, that can happen without anything else changing. And so you had prescribed a medication that worked amazing, and it probably lasted, I would say, about 6 weeks till that and then it went away and it was gone.
Great. Speaking about your GLP networking group, so one of the great things about Vicki is that she's connected to like everybody in the South Bay. But you did, so one of the things about our program is that we don't go through insurance, and you did qualify, under the FDA description of the use of the GLP medications to be covered under insurance.
I am on Medicare. I'm well over 62.
No.
I will actually be 77 on my next birthday.
Oh my gosh.
So I know. It doesn't seem like it.
It doesn't.
But none of the Medicare programs approve for GLP for weight loss.
Okay.
They're trying to change that, but as of right now, they don't.
Okay.
So I really didn't have an option to go anywhere that I was going to be able to have insurance pay. I was going to have to self-pay. I didn't want to go to the online ones because that just kind of scared me a little bit. So when you brought it up, that you were doing it out of your clinic, it was just the perfect answer for me. I felt like I'm being monitored by somebody who knows what they're doing, as opposed to an internet doctor, not to,
Yeah, it's just a little bit more personalized care. Yeah.
Exactly.
And then you mentioned also at one point that Weight Watchers was bringing these into their kind of model of weight loss. So tell me a little bit about your experience with that too.
Yes, and I am a member of Weight Watchers, and I do their GLP program, not for the injections. That's a clinic, that's a whole separate side. I do their regular program, so I follow that. Program is it's amazing because unlike if you've ever done Weight Watchers, I think everybody knows it's a point system. With their GLP side of the house, that it's not that way at all. They have you track 3 things. You track protein, fruits and vegetables, and water. And that's the only food that you track. And so there's no points. You can see what your points are. So you can see if you're making better choices, perhaps if something has the same protein value. But as long as you get the 60 grams, and 60 is my number. Right. The number is based on your body type and your weight and all that. So mine is 60 grams of protein. And I realized, because I just started it about a month after I started the GLP, and I thought, I am not coming close to 60 grams of protein. So it really made me rethink what I was eating and how I was eating it to get that amount of protein in. And then the 4 fruits and vegetables was also really hard because I didn't have room to have 4 fruits and vegetables after I got the protein. So sometimes I would have less fruits and veggies. Sometimes I'd have a little less protein, but I tried to keep it balanced. And then the reminder of the water, because that all has to do with the movements.
Exactly.
Too, so.
Well, and the medication works in a way on the brain that it also suppresses your thirst because the hunger center and the thirst center are so closely connected. So it also suppresses that signal that you're thirsty. So that's one of the things that we really have to remind patients of when they're on this program, to drink water. And I hate to be the one to carry my little Stanley around, but that actually is a really good reminder that you do need that much water during the day. But I was really, because we have these chats whenever Vicki comes in for her monthly visits. But the Weight Watchers thing I thought was really interesting because it sounds like a great adjunct to any GLP program.
Exactly.
Even if you're not getting the GLP through Weight Watchers, there's still a really valuable nutrition and dietary part of that could benefit a lot of patients.
Absolutely.
And then the other thing that I thought was really interesting that you shared with me was exercise and like gym memberships and kind of a hack that you have for that to get some of that covered through your insurance. So can you share some of that?
Sure. And it's kind of a fun benefit in the Medicare insurance programs, and I that's all I can speak to. But many of them have gym memberships, and there's two. One is called Silver Sneakers, which is one that most people know about. It's the original plan that was the only one that was there. I researched that, and I won't name the gyms, but the gyms that were included were not ones I would choose to go to. They just weren't places that I really wanted to go. And then there's another one called One Pass, and that's what I have through Scan. And through One Pass, the Pilates studio that I was going to and paying $200 a month for is on that plan.
Wow.
At zero cost to me. The YMCA is on that plan. I hear this new stretch place that's just coming out, I'm just seeing, is on that. So there's some really great gyms on it. So I do 1 or 2 Pilates classes a week, and I go to the Y probably 3 mornings a week, and I do their water exercise, and that's at no cost to me at all. So this is a win. I just started this maybe a couple months ago, that I told you about, and I love the Y.
It sounds like you have a small community of friends at your water aerobics class too, so it's good social, social connection.
It totally is, yes. And the Y, the showers are out in the open. There are private ones, but you have to kind of stand in line and wait for them. And so I'm not, going back to the breast cancer and the reconstruction, I feel like that's okay. I'm not embarrassed, about, how I look, because nobody could tell that, they're not my own.
Yeah.
So.
Well, they are your own.
They are my
They're
own.
just we used a little spare parts to make them. That's it.
Luckily, I have the spare parts and the time to do.
Exactly. Thank you so much for sharing.
You're
I
welcome.
really appreciate it, and I know that you're such an advocate of the practice, and you're so open and welcoming to everyone that asks you questions, and just all the knowledge that you've given me that I can share with all of our patients. I really appreciate it. And
happy to help. You've done so much for me.
Thanks. So hopefully that helped everybody who has seen this video, and we'll follow up with the next set of tips and tricks that Vicki has for us.